Health Minister Dr. Frank Anthony, in his announcement on Monday, would only say that the vaccines are expected to arrive in Guyana soon, as an initial start to the COVID-19 vaccination drive.
I received correspondence from Covax indicating that they have been able to do an indicative allocation of vaccines to Guyana, or doses of vaccines to Guyana, and that is going to be close to 104,000 doses of vaccines that we will be getting shortly.
He further divulged that the ministry will continue to work with Covax to secure a timeline for the arrival of the vaccines into the country.
This is much more than we had anticipated in the first wave, because initially they had told us that we'll get a smaller sum in the first wave, but now it seems that we'll get a bigger lot. But we are nevertheless prepared to receive the vaccines. And as I've said before, we have already trained our teams to start going out and using the vaccine.
The vaccine, which was developed by the University of Oxford and Astrazeneca, has been granted emergency approval in the United Kingdom, India, and other countries. It is 70% effective at preventing infection from the virus in more than 11,000 participants in late-stage international trials. At the weekend, Director of the Pan American Health Organization, Carissa F. Etienne, disclosed that Covax, a coalition led by WHO and Gavi to ensure equitable access to COVID-19 vaccines, notified countries in the Americas of the estimated dose allocation for the first phase of vaccine delivery in a letter to health authorities. She noted that delivery will commence after the World Health Organization concludes a review and issues an emergency approval. Guyana is among 36 other countries that received letters from Covax. Meanwhile, Guyana has recorded 35 imported cases of COVID-19 since the reopening of the airports on October 12, 2020. Temika Rodney reporting for the HGP Nightly News.